Welcome back, everyone. As part of New Year, New You Week Focus, we wanted to pay attention to the one place that you might not consider important to your overall health, your mouth. And if you're still working on a healthy body resolution, our next guest wants you to know that a healthy mouth is part of that equation. Dr. Mathew Kent is with Partners in Dental Health, a wavy expert on your side. Dr. Kent, welcome to the Hampton Roads Show.
Thank you. It's great to be here.
So a lot of folks, are making New Year's resolutions, wanting to have a healthy body, but also it's very important to have a healthy mouth as well.
That's right. And it really starts with what you're eating, your daily consumption, eating healthy foods, getting good fruits and vegetables. It starts there, and that not only help with your oral health, but it's going to help with your overall health too.
So what are some of those foods that if you're going to grab it, you may want to kind of think twice and go, oh, is this so healthy for my teeth, or maybe not eat as much of it?
Yeah, well, anything that has a lot of sugar in it, those simple carbohydrates, those are the things that are going to do not only damage to your mouth, but it's going to add calories to your daily calorie intake. So those are the things you really want to try to avoid. And it's also that frequency. If you're going to have a treat, try to have it with a meal. That's going to limit that sugar exposure and limit that frequency. So.
All right, so what about some preventative costs? If you do end up in the dentist chair, what are some things that you need to consider?
Well, prevention is definitely key. In medicine nowadays, it's big. In dentistry, it's big. It's definitely advancing. We're finding new ways that we can prevent diseases from starting, and even in reversing some of those bigger diseases too, like periodontal disease and caries. Well, with caries, we're detecting them a lot sooner than we were before. With digital x-rays, we're able to see them before they get bigger, and we're able to give patients directions on what they can do to help prevent those cavities from getting bigger.
What about some cosmetic changes that you guys do? Talk a little bit about that.
Well, we're doing some new advances with veneering and bleaching that can really get a big change in people's mouths and their smiles. So veneers are really a conservative way to give a big change to your mouth. And in certain cases, limited cases, we can do just one tooth, and that can make a big difference on a smile. Other cases where there's teeth that are really disfigured, we can do minimal preps and make a big difference.
That was a before and after if folks saw. So let's, just kind of explain a little bit what we're looking at. Of course, we saw before, and then this is what the after. Here, what are we looking at here?
So that's a big change for a patient that had a lot of spacing in between their teeth. We did some ortho, we did some crowns, we did some veneers. We made a big change in her mouth. Wow.
What about bleaching? What are your thoughts on like the home kits, or do you recommend coming into a dentist or getting it done, or just even having a consultation about doing that to your teeth?
Yeah, bleaching is one of those things where you kind of get what you pay for. If you go to the dentist, in our practice, we want to provide something that's quality. And we're going to do stuff now that we couldn't do before. We're going to do stuff that's going to change people's teeth that have intrinsic stains that are deep down in the teeth.
Are we looking at some before and afters here?
Yes.
Kind of explain too, this has to do with bleaching, yes?
Yeah, so we create trays that are custom made for the patient that allow them to put bleaching gel inside that tray. It's a high quality bleaching gel, and it helps make a big difference in the patient's smiles.
You deal with this day in and day out. What does it do for you, and how does it make you feel to see your patients come in maybe real self-conscious about their mouth, and then when you guys do something where it's like veneers or bleaching, what does that do for you, and how does that make the patients feel?
Oh yeah, it's very rewarding. It's being a dentist nowadays is such a rewarding job because we can make a big change in someone's mouth, not only their health but their smile too, and that can change their whole life.
And I have a question for you. I've heard mixed reviews, but it's something as simple as like your toothbrush. You have soft, medium, hard.
Yeah.
What's that difference? What do you recommend people use? I've heard soft, medium.
Yeah, soft is better.
Okay.
Flossing is the key. Yeah. So I always tell my patients, only floss the teeth you want to keep. So.
We're going to end on that. Very good information. Partners in Dental Health, a wavy expert on your side, has locations in Virginia Beach and Norfolk. You can give them a call, 499-2100, or go to partnersinhealth.com. Dr. Kent, some great information. Thank you very much.
Thank you.